I'm Tony O'Brien. I'm the Director General Designate of the HSE. I want to talk a little bit about Future Health, which is the government's new strategic framework for the reform of the health service. But first, I want to acknowledge the enormous contribution of our staff this year, both in terms of the achievements that have been made, which are quite considerable, particularly in the area of access to our services, but also to recognise the response of colleagues to the enormous challenges we've had in terms of the numbers of colleagues who've left, the reduction in funding, and in particular the financial challenge that occurred in mid-year and the way people have responded really positively to ensuring that the maximum amount of our resources could be made available for patient care, and I really appreciate that. Future Health is a strategic framework which sets out the steps we now need to take to change the health service to the type of health service that the government envisaged when it came into office. So there are a number of things of importance in that. The first is that the direction of travel is to bring us to a stage when we have universal health insurance, which means that people are treated according to their need and not according to their financial means. It also involves changing the way money flows so that our services are funded in accordance with the numbers of patients they treat and for what, in order that we don't have oddities around the way our services are funded that can sometimes get in the way of treating patients and clients in the way that they need to be. It also involves some structural changes. We want to bring ownership of services closer to where patients are treated and where our people work. And that means moving from a centralised structure as we have now to having our services organised in groups and trusts, which ultimately will become fairly autonomous, leading to a lot more flexibility and innovation in the way services are managed and delivered in a way that makes more sense to people at the front line of our services. And I've already mentioned universal health insurance, and that really, if we can get to that stage, and it's a big ambition, will mean that we could have a health service with all the other changes that we're truly proud of, both as people who work in it and for the population at large who depend on it. I think our staff probably have already started seeing them, particularly those who've been working with the clinical programs in the many domains where they've made huge progress. The 48 actions begin to kick in over a period of time, but the important thing is that this will be done in a structured, careful, pre-planned way as we begin to build the new structures of the health service within our existing structures. So, for example, a Patient Safety Authority, the Future Healthcare Commissioning Agency, these will all grow from within the HSE, as will the trusts and groups into which all hospitals and other services will in future belong. So our staff will at each stage of the journey know where they are in that journey, and we'll have an opportunity to shape it.